Good morning and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well this morning. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
I'm good. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, public health, and infectious disease questions each week here on the Havey Institute for Global Health Facebook page. Today, Dr. Murphy will be answering viewer submitted questions, addressing the latest headlines, and our lone US COVID statistic through today, April 25th. We invite you to submit questions down below or via any of our social media linked in the description. Starting with that abbreviated COVID statistic, average COVID deaths per day in the last reported week were 57. The same week in 2024, we saw 105. Dr. Murphy, your reactions to those numbers?
Well, basically no change. It's still out there, but it's low. COVID, that is. And the good news is, of course, it's much less than it was in 2024, which was 105. And it's dropped down to 57. Now, these numbers fluctuate just depending on how the reports come in and whatever. But I don't know if you remember a few weeks ago, it was almost 3 times as many cases in 2024. And now it's like twice as many, if that. So it's getting a little bit tighter here as we get off season and there's fewer cases. But anyway, it's going in the right direction, but it's not gone away.
Mm-hmm. And speaking of it not going away, we do have an update on that Novavax COVID vaccine. Some good news there. There was a delay in approval. Can you tell us what's changed?
Yeah, so there's basically 3 vaccines used in the United States. So the Moderna and the Pfizer, which are these mRNA technologies, this new technology, new like 20 years ago. And then the more traditional approach, protein-based vaccines, which is includes the Novavax vaccine. So they had emergency use authorization, and this is the application for the full approval. And because of all the transition in DHHS and getting things approved, it was delayed, but now it looks like it's on track for full FDA approval. So, if you want to take Novavax, it's a good vaccine. Great. I mean, it's really not any better or worse than the other ones. It's just a very different type of vaccine and more traditional and related to the other vaccines that people normally take. So some people, if you feel more comfortable with that approach, go for it. It works.
Absolutely. And that's the exact reason why there was a little bit of umming and ahhing about the delay of that approval, because a lot of
Yeah,
people feel more comfortable with the protein-based
yeah.
vaccine.
I mean, the problem with the traditional approach, it takes longer to develop the vaccine, and you can't change it as quickly as the mRNA vaccines. But it works just as well.
Mhm. And speaking of development, there is ongoing development for COVID drugs. There was a very, very early animal-based study released with some interesting data about drugs that could help with COVID. Can you tell us about those?
Yeah, so this was an early publication coming out from researchers at the University of California, San Francisco, and the Gladstone Institute there, looking at 2 new compounds that just have numbers, AVI 4516 and AVI 4773. And it's a study done in mice. And it showed it was much more potent, 1,000 times more potent than Paxlovid. And but this is just mice, so there's a long way to go before this goes anywhere. Very few people now are taking Paxlovid. It is approved if you have underlying diseases or at all at risk for having a bad outcome from COVID. You should take it. It's covered by most insurance and is only taken for 5 days. There are some drug interactions you have to worry about, but most people can get through it. And so it's nice to have some better drugs, but we're going to go through the same thing we did with Tamiflu. With flu, it was popular, and then it became unpopular, and now it's kind of popular again, and it's going to wax and wane depending on how bad those endemics really are.
Mhm. And before we transition into our full measles coverage for this week, there is a little known but very, very important vaccine program for children here in the United States that has seen some budget cuts, which could have large consequences. Could you tell us about those and what the program is?
Yeah, so Congress created this program. It's called Vaccines for Children in 1993, after there was another U.S. measles epidemic that killed dozens of children a few years before that. This was a very successful program, and ultimately it covers about half of the children in the United States that are taking these protective vaccines. So it it's a great program. It was put into place. It worked, and it's covering half the programs. And looks like it's going to get cut. This is another huge mistake. Um, it's just I don't know why anybody would want to cut it, because so many, especially with measles, it's so contagious, and the only way to really prevent it is with the vaccine, unfortunately. So CDC employees who staffed this program were largely untouched. That's good. But 20 others who comprise a unit that promote the program in communities with the highest unvaccination rate were the ones that were canceled. And at the same time, they cut $11 billion in COVID-related grants, and COVID is over. COVID's not over, as we talk about. But anyway, this is just another bad public health move.
Absolutely. And getting into our submitted questions for today and more into the measles, the first question comes from a longtime viewer who asks that when they traveled internationally, in this case to Indonesia, back in the mid 90s, they received their standard travel shots. Does that include the MMR vaccine?
It probably did. I don't know exactly what this person got, but that would not be an unreasonable vaccine to give to somebody traveling to Indonesia in 1995. But we don't know the vaccination rate there. We think it's low. So don't know. Now there's a way to check though. Number one, you can go through your records and see if you ever got it. But we don't have a universal vaccine card typically, unless you travel internationally a lot. But you can do an antibody test that tells you if you were exposed in the past, because the antibodies stay forever. So that's one way, or you can just take the vaccine again if you're unsure.
Absolutely. And piggybacking off of that, should an older person, say 70 years old, who has never had measles, get a booster dose?
Mm-hmm. Well, okay, so this is a good test question. Person is 70 years old, so they were born in 1955. So the recommendation is if you're born before 1957, or if you're born, excuse me, after 1957, you probably got the vaccine. Okay. And before that, without the vaccines, everybody got measles. So this person falls into that everybody got measles category by at least 2 years. So most people, measles, the symptoms really vary. They can be very mild. They can be mistaken for something else. Not everybody has the classic measles. Not everybody has severe measles. So just because you don't remember having measles that long ago doesn't mean you didn't have it. Matter of fact, it's so contagious, you probably did have it. If you just follow the guidelines here, this person doesn't need anything. However, if you're really concerned, you absolutely believe you never had the measles, go get an antibody test like I just talked about. It's a pretty simple test.
Absolutely. That's a great course. And Can you
Mhm.
break down the current status of the measles outbreak and just measles cases across the US?
This is turning into basically a disaster. There's now over 800 cases in 26 states. 96% of the people are unvaccinated. There's now even a case in Illinois. Um, and so we have experts, epidemiologists that model these diseases. And if the vaccination rate doesn't go up at least 5 percentage points, it measles will become endemic in the United States again. In other words, we won't be able to get rid of it easily. It's going to be really hard, and it will require a mass vaccination program. On the other hand, if it drops overall by average 10%, there's going to be over 11 million cases over the next years, which includes 2,100 deaths. So it's just really sad. So this is what happens when you lose the herd immunity. Basically, everyone that didn't have the vaccine is going to get infected. So there's plenty of
Yeah,
people out
really.
there. So it's just a highly contagious disease. And not only, I mean, okay, you have 1 to 3 people per thousand die. I mean, that's still a lot. These are mostly children. Um, you know, that's nothing to write off. I mean, in the year 2000, we had no cases of measles. It was completely gone. But a lot of these kids end up in the hospital. So you can be very sick in the hospital with measles, whether you're an adult or a child. And it's just a shame that this is what's happening now. But it's going to take mandates for vaccines to get this under control. In my clinical days in the hospital taking care of patients, one of the sickest patients I had was an adult with measles. We couldn't figure out what was going on. And it ended up being a case of measles. Person had visited a country that had low vaccination rates, came back with a very atypical presentation, liver disease, and was confused and everything. And finally, we figured it out. It was atypical measles, but very unfortunate.
And you've touched on this in previous episodes and today, but the name of the game for measles is prevention. There's not a standard treatment, if I'm correct.
No, there's no treatment. And vitamin A is not a treatment unless you live in a country where everyone's vitamin A deficient, which we don't. So please be careful. There's already been toxicity from vitamin A overdoses. Vitamin A can be toxic. So this is and it's only for treatment, not for prevention.
Mhm. Very important to note there. Our final story for today is touching back in with the avian flu or bird flu H5N1. There's been a very serious case overseas, as well as another hat in the ring for an avian flu vaccine. Can you fill us in?
Yeah, okay, so it's really two things. So Vietnam reports its first case in a while and the person has encephalitis, so that's very severe. And we don't know the outcome of that person. This is a young 8-year-old girl in Ho Chi Minh City. And the girl has underlying cardiac problems and she remains hospitalized on a ventilator. Meanwhile, these flu vaccines, you have to have a very specific vaccine for the type of flu. So avian flu, there's a different vaccine for that. The regular flu, there's a different separate vaccine. They don't work for the other type of flu. So, but and every year, that changes. So, the vaccines have to be updated. So, there's a couple companies, Diocinvax out of the University of Cambridge in the UK, and ACM Biolabs from Singapore, and there's also groups here at the NIH and elsewhere looking for that universal flu vaccine where it will work for all types of flu. And this is just a report saying that they're working on it. It's who knows how long it's going to take to develop and if it's going to work. But this is the direction we've wanted to be going in for a long time.
Absolutely. These are the long-term investments in our health that we hope will, pay dividends in the future.
Right. We have to continue with the basic research to get to this point where we have a better vaccine. If we cut the research, we're never going to have it, and we're going to be stuck in the position we're in now.
Absolutely. That's an excellent point. And on that note, I'd like to thank you, Dr. Murphy, for your time and expertise this week, breaking down all the data and bringing us the latest news.
Well, great. Thank you, Katie. Have a good weekend.
Thank you. And thank you all for joining us for this week's episode of the Ask Dr. Murphy series. We hope to see you again next week. And as always, if you have any questions or comments, please leave them down below or at any of our social media linked in the description. We'll see you next week.